Hello, everyone. Thank you for joining this meeting and this movement. I have been tasked by the organizers to talk or discuss with you youth policy making and advocacy in colon cancer prevention and control. There are many ways to talk about this, and there is a lot to say about this. But today I chose to experiment, and instead of giving a talk for the next 10 or 15 minutes, I will sit down and listen with you. What are we going to listen? We're going to listen to what this presentation or this discussion would be if I had the chance to discuss the same matter with a Minister of Health of a European country, trying to persuade him to include young people like many of you and like me in his national cancer movement, in his national cancer plan, and why not to a global agenda against cancer. So let's tune in and talk to you soon.
Well, a bit unexpected. We're going to be looking at the role of young people in fighting cancer.
Oh, interesting.
Yeah. Specifically, we've got this transcript of a meeting, and this is what makes it so interesting between the Minister of Health of Luxembourg
Okay.
and this young doctor who's really pushing for more youth involvement in cancer control.
I see.
Gets, a little heated in places, which is, always fun. But there are some really fascinating insights that emerge.
Right. Luxembourg, for those who might not know, is a small European country. It's nestled on the Iberian Peninsula, just north of Spain and Portugal. And they're actually in the process of creating a national cancer plan.
Oh, wow.
Yeah. This meeting is like a part of that whole process. The minister wants to hear from all sorts of experts and stakeholders, and they decided to start with colon cancer.
Got it. So who are the main players in this conversation?
So you've got the Minister of Health, kind of a seasoned politician, actually used to be a finance professor. And then there's Dr. Christos Tsagkaris, who's a young medical doctor, and like you said, a real advocate for this.
And right from the start, you can feel the tension. The minister seems really skeptical that young people can actually contribute anything meaningful to something as complex as, cancer control.
Yeah, you can almost sense the minister's doubt as he's like reading through Dr. Tsagkaris's proposal. He just sees colon cancer as something that affects older people,
Right.
and he doesn't really see how young people can offer any solutions given their, lack of experience.
Yeah, there's this moment where he even implies that young people are just more concerned with their own lives than
Hmm.
these, bigger societal issues. But Dr. Sakaris pushes back on that pretty quickly.
Oh, really?
Yeah. He clarifies that when he's talking about youth, he's not just talking about teenagers like high school kids. He's talking about the 17 to 35 demographic,
Right.
which is actually a pretty significant group.
That's a good point.
Yeah. It includes, young professionals, many of them working in healthcare
Yeah.
and related fields.
Yeah.
They're tech savvy, they're super connected, and they're already making their mark on the world.
It's a whole different way of looking at it. Yeah.
Yeah, exactly. And Dr. Sakaris makes the case that they're not just the future of healthcare, they're a vital force right now.
He makes a good argument there.
But, you know, the minister's not totally convinced. Remember, he comes from this finance background, so he wants to see concrete results. He's not interested in just good intentions.
Mm-hmm.
He wants to know how these young people are actually making a difference.
I see.
Like, how are their efforts actually translating into tangible impact? He even says something like, taking selfies with slogans isn't enough.
Okay, that's fair.
And Dr. Sakaris gets that. He acknowledges that awareness campaigns are just one part of the puzzle.
For sure.
And then he starts laying out these concrete examples of how young people are, going beyond awareness and actually driving real change in cancer control policy. Okay, I'm hooked. Give me an example. What did he bring up?
So he starts by talking about this thing called the Madrid Declaration for a Tobacco-Free Generation by 2040, which was launched in Spain.
Interesting.
Yeah. And this declaration basically pushes for stronger implementation of the WHO Framework Convention for Tobacco Control across Europe.
And for our listeners who might not be familiar, can you give us a little background on the WHO Framework Convention?
Sure. So it's basically a global treaty aimed at reducing tobacco use and protecting people from, you know, the harmful effects of smoking.
Right.
It's actually like the first international treaty that was negotiated under the World Health Organization, which is kind of a big deal.
Wow.
Yeah, it lays out all these comprehensive measures that countries can implement,
Okay.
covering everything from taxes and smoke-free policies to like how cigarettes are packaged and labeled, and because smoking is a leading cause of cancer.
That's probably lung cancer.
Right, exactly, lung cancer especially. So this treaty has major implications for cancer prevention, like globally.
Makes sense. So how did young people get involved in something so high level?
That's the cool part. Dr. Tsagkaris mentions this program, the Ambassadors of the European Code Against Cancer.
Okay.
And it basically trains young professionals to advocate for these cancer prevention policies.
Wow.
And these ambassadors were actually instrumental in pushing for the Madrid Declaration. They were gathering support from policymakers, raising public awareness,
I see.
really showing that young people aren't just interested in abstract ideas, they're working within the system to make things happen.
Yeah, that's a great example of how they're actually engaging in policy discussions.
Absolutely.
But I can already hear the minister, in my head
Uh-huh.
saying something like, well, Listenberg is a small country, we have limited resources, and we need to be strategic about where we put our money.
You're totally right, and that's exactly what he says. He points out that they have to justify every euro spent on healthcare, especially when it comes to prevention for a disease that's typically seen in older adults.
So how did Dr. Tsagkaris respond to that?
Well, this is where things get really interesting. To counter the minister's focus on Listenberg's limited resources, he kind of shifts the conversation to the global stage.
Okay.
And he starts talking about how young professionals are making their voices heard in these huge international policy forums. He brings up the G20 youth summits.
Oh, wow. Okay.
Yeah, and the European Health Parliament. And in these places, young people are actively participating in discussions about, global health and well-being.
It's pretty incredible that they're involved in those kinds of summits.
Right. It's not just like they're, sitting in the audience.
Yeah.
They're actually at the table.
So what are they actually suggesting? Are they, sticking to these broad statements, or are they getting into the nitty-gritty of policy recommendations?
Oh, they're definitely getting into specifics. Like, for example, Dr. Tsagkaris talks about how at the G20 Youth Summit in Varanasi, India, he and his peers actually worked to integrate cancer prevention into the broader discussions.
Oh,
Yeah, they were talking about holistic well-being, the future of work, even democratic governance.
that's interesting.
Yeah, they're making the point that health isn't just about healthcare.
Right. It's about all these other things.
Exactly. It's tied to so many different aspects of our lives.
So they're kind of arguing for this more holistic approach to cancer prevention.
Exactly. And get this. The outcomes of these youth-led sessions were actually presented at the UN's World Food Forum in Rome.
Oh, wow.
Yeah, isn't that cool?
Yeah.
It just shows how they're making these connections between seemingly totally separate areas.
Like food security, economic development, global health, it's all connected.
Exactly. It's all part of the same puzzle.
So it's not just about raising awareness about cancer.
Right.
It's about understanding how it fits into this broader picture.
It really is. They're elevating it from a health issue to a matter of global importance.
I love that. But I can already hear that minister in my head again. I imagine him saying, okay, these global summits are great, but I need to see practical solutions. I need to see results.
Yeah, and he wouldn't be wrong to ask that.
Right.
So, to really drive home the real world impact of what young people are doing, Dr. Tsagkaris brings up examples of initiatives in some of the toughest contexts imaginable. Conflict zones.
Oh, wow. Okay.
Yeah. He talks about this conference, BIMSIO, in Ukraine,
Ukraine.
and the LAMSA Youth Committee in Beirut.
Wow. So even in places dealing with war and instability, young people are prioritizing cancer prevention.
It's really powerful, right? They're not letting these conflicts stop them from working towards a healthier future.
What kind of things are they doing in these places?
Well, so for example, BIMSO focused on building capacity for cancer research and care in Ukraine,
Okay.
while the LAMSA Youth Committee in Beirut is pushing for policies that address the unique challenges young cancer patients and survivors face in that region.
That's incredible. I mean, it shows real resilience.
Doesn't it? Like this deep determination to make a difference, even when things are so tough around them.
And it's not just about the actual work they're doing on the ground.
Right.
It's the message it sends.
Mm-hmm.
Choosing to focus on cancer prevention, even in conflict zones, really emphasizes the idea that health is this fundamental human right.
Exactly. It's something that should be a priority no matter what.
I bet those stories had a real impact on the minister.
They did. The whole tone of the conversation shifts. He starts actually acknowledging how resourceful and dedicated these young advocates are.
So it seems like Dr. Tsagkaris was successful in proving that young people aren't just passionate.
Right.
They're taking charge and coming up with solutions in a way that maybe previous generations haven't.
Absolutely.
But what does this whole conversation happening in, a small European country have to do with our listeners?
It's bigger than Listenberg. It reflects a global change in how we're approaching healthcare and advocacy in general.
Okay.
It's not this top-down model anymore, where just a few people make the decisions.
It's becoming more inclusive.
Yeah, we're starting to recognize the value of hearing from all kinds of people.
So let's stop listening. There is still a lot that artificial intelligence and interpretation of the script that was written by me can offer, but we need to close this talk and keep what is important. So we need to remember that young people have proven potential. We also need to remember that young people have used this potential not only within their professional sphere of their personal life, but exactly on topics that have to do with cancer prevention, with cancer control. And they have not only done this in a focused and isolated manner, but they have, in many occasions, integrated this into global policy-making discussions. And this shows something that is important, something that is an overall shift for all agents in cancer prevention and control, transforming our action from reactivity to proactivity, not expecting the problems to come and meet us, but taking such action will prevent problems from happening. And this is a very important point. And with this, I believe that we had the chance to go through and listen together to some good examples of youth advocacy. And this is not the end of this, but this is probably the beginning of searching for similar examples around your countries, your networks, your work, your own cancer research, your own cancer advocacy. And based on this potential, taking some more steps to give flow to young people, make them part of the conversation, and see how they can better work with you. I would like to thank you all for your attention, and I would also like to acknowledge here the idea behind this format, which is different. It was a video by Dr. Gale from the WHO Europe, presented at the European Public Health Conference that followed a similar format and gave me this idea. And of course, this has been done with the assistance of some softwares, including Notebook LM and Canva. I also need to highlight that although the names of many organizations were mentioned during my talk and during the script, uh, I have been part of some of them, so they reflect some personal experience, but they cannot be considered as an official statement or a representation of any of these organizations. These are personal recollections, personal experiences, and after thanking you for your attention, the organizers for giving the floor, I'm certainly happy to respond to questions now or to take the discussion further through an email or LinkedIn chat. Feel free to reach out. Thank you very much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.